there are 12 systems. First, let me start off with the digestive system. Before entering into the disease and the common treatment, let me see about the outlook of the digestive system. Digestive system starts from mouth to ends with anus. Like when we eat food through mouth, the food along with the saliva, the food does break down into a small fine parts, and through this peristaltic movement through esophagus it enters into the stomach. From the stomach it reaches into the intestine like large intestine and small intestine, and finally reaches to the rectum and the anus. This is the outlook of the digestive system. Now we will see about the common disease in the digestive system and the treatment for which they have given. Anorexia, it is loss of appetite. Appetite they won't show interest in eating. Ascites, it is accumulation of fluid in the peritoneal cavity, like always they feel like bloating. Constipation, difficulty in passing stools, of course we have all known about this. Diarrhea, frequent passing of stools. Dysphagia, it happens in the esophagus like difficulty in swallowing. Okay. Jaundice, due to the high level of bilirubin in blood, we may have yellowish discoloration of skin and eyes. It is commonly called jaundice. Melena, it is black tarry stools, blood in stool. Hematochezia, it is passage of fresh bright red blood from the rectum. I have missed to enter the word blood. Please make a correction of it. Hernia, it is a protrusion of the organ parts through the muscle. Depending on the location, hernia is divided into 4 types, that is above the stomach is epigastric, and in the center of the stomach is umbilicus. In the sides of the thighs are inguinal and femoral. These are the hernia types. Gastric carcinoma, it is the cancer of the stomach. Crohn's disease, it is inflammatory disease of the intestine. Diverticulosis, due to the weakening of the intestinal muscle, there may be a pocketing of colonic mucosa, that is internal of the intestine. Peptic ulcer, it is ulceration of the mucosal of stomach and the duodenum. It's commonly the ulcer problem. Cholelithiasis, it is the gallbladder. Gallstones, it is stone formation in the gallbladder. It is the cholelithiasis. Hepatitis, as I before said, itis is inflammation and hepatic is liver. So hepatitis is inflammation of liver. Pancreatitis, it is inflammation of pancreas. Cirrhosis, a degenerative disease of the liver. Liver cancer, that is malignant tumor of the liver cancer. It is the stages. Okay. Apart from the above diseases, I have missed to enter some of the diseases like esophagitis, it is inflammation of esophagus. Appendicitis, inflammation of appendix, and also the colon cancers like rectum cancer, anal cancer. These are the some of the common diseases found in the digestive system. Then comes to the diagnosis. Some of the common diagnoses like what are the common tests to confirm the diseases, like common blood test, ultrasound, endoscopy, colonoscopy. These are the things. What are the most common treatment? First, they will give for medication. They will change in the food habits like eating oily, reducing the oily foods, drinking plenty of waters, like changes in our day-to-day lifestyle. Then comes to the surgeries like gastrectomy, it is a removal of stomach, hepatectomy, pancreatectomy, appendectomy. These are some of the most common procedures I have seen. Oh, thanks for watching, and we will see in the next session with some other topic, and I am also expecting some suggestion, questions and any other queries related to this session. Thank you.